Hi, my name is Helen. I'm a nurse working in specialist palliative care. I'm going to talk about constipation, what exactly happens and how best to manage and prevent it. Nurses and doctors often seem obsessed with asking questions about your bowels, and hopefully by the end of this talk you'll understand why that is. To help us understand constipation better, we'll look at what constipation is, what causes it, what the symptoms are, and then how we treat it. So constipation is when there's a decreased number of bowel motions or difficulty having a bowel motion. Everybody is different, and that's important to remember. Some people have their bowels open every day. For some people it might be twice a week. It's important to try to remember what your normal pattern was, and we'll try to get you as near to that as possible. To try to understand what causes constipation, it's important that we understand how the bowel works. When you eat something and take food in your mouth, you chew it and swallow it, and it travels down your esophagus until it reaches the stomach. Here it's like a washing machine effect. Water floods in from the body and churning and mixing up with the food. It then passes into the small bowel and into the large bowel. All the while, the bowel muscles are pumping and pushing it forward at the same time while slowly drying out the stool as the water returns to the body. There's approximately between 7 and 8 meters of bowel to travel, all tightly packed behind your abdomen. So it's a good bit of distance for it to go until eventually the stool is formed and it's passed through the rectum and out the anus. There are a lot of things that can cause the bowel to move slower, for that pump system or the bowel muscle to be weaker. If you're not taking enough fibre, if you're not having enough liquids, then the amount of water even at the beginning in that washing machine effect is less, so the stool is drier before it even starts its journey. If you ignore the urge to have a bowel motion, the stool is sitting in the bowel for longer, so again it's getting drier as it's there and it makes it more difficult to pass. A lack of exercise will reduce the muscle strength, and a lot of medications can cause the bowel to be slower. Changes in your lifestyle or routine can lead to constipation too. If you've been travelling, for example, you may be eating different foods at different times and your whole daily routine is different. A loss of appetite will result in you eating less, so your bowel tends to slow to get used to this. If you've lost weight recently, your muscle tone or strength at least may be weaker. If you've got a low mood or are fatigued or extremely tired, every system tends to slow that little bit because your energy is less. And sometimes if you're breathless, this can lead to constipation too, because you may not have the push to actually pass stool. For anyone who's ever been constipated, you'll know the symptoms well. You're generally miserable. You might have very small to no appetite at all. You might even be nauseated or feeling sick a lot of the time. You may vomit. You might have stomach pain or cramping, feeling bloated and full. You might even have increased fatigue, and increased shortness of breath can be a problem at times as well. Sometimes when you're constipated, you can get what's called overflow diarrhea. This is where the bowel, like a pipe, is blocked by hard, packed stool, so only the liquids manage to pass that blockage. It may seem like diarrhea, but it's not a true diarrhea and needs to be treated like constipation. This is where a lot of the questions we as nurses ask about your bowel motions come into play, because it will give us the information we need to figure out if you've got true diarrhea or an overflow diarrhea. A lot of the time, the questions that we're asking about your bowel motions and when your bowels moved, the consistency of what you passed, and how often you're going, and questions like that will give us a good idea of your bowel pattern. Sometimes we may need to have a look at your abdomen to see that it's soft, or is it hard, or is it bloated. In some cases, we may need to check your back passage or a rectal examination. And in other cases, we might even need to do an X-ray of your abdomen. So how do we treat constipation? It's so important to be able to sit comfortably on the toilet without any pain or discomfort of any sort. You need to allow enough time for the bowel to completely empty. You need privacy. Research has shown the strongest urge to have a bowel motion is about 20 minutes after your breakfast or your first meal of the day. Try to establish a pattern where you head to the bathroom at that time. Try to eat regular meals, and that may even just be small meals more often, because it'll keep the bowel working. Try to take as much fluids as you can. Try to eat more vegetables, fruit, fibre, and even drinking juices. Prune juice in particular has been proven to be very effective for the bowel. Exercise helps to keep the bowel muscle tone strong. Finally, you may need laxatives to help with constipation. There are two main groups. One is a softener group, and these are things such as lactulose or Movicol. The second group is a stimulant group, or pushers, which are things like Senecot. The softener will make what's in the bowel softer, while the stimulant helps to push it along the bowel so that you can pass it that bit easier. Usually the combination of a softener and a stimulant is the best advice, but you should seek advice from your healthcare practitioner, either your nurse or your GP. It's often helpful to keep a bowel diary or put a simple mark on the calendar that only you know about to indicate when your bowels have moved. So at least you can establish a pattern of how your bowels have been behaving and you're not relying on memory alone. And of course, prevention is always better than cure. But if you do have symptoms of constipation, please talk to your healthcare practitioner, whether that's your nurse or your GP, for advice. Thank you.